Well, cardiovascular disease is responsible for 1 in 3 deaths in the United States. And now new research shows people who are at risk of heart disease should start taking steps to lower their cholesterol when they're in their 30s. The authors say the longer a person lives with high levels of LDL or bad cholesterol, the more likely they are to develop heart disease. Joining us now with more on this study and information is Dr. Zack Kegley with HMG Primary Care at MeadowView. Dr. Kegley, thanks for being with us this morning.
Thanks for having me again.
Certainly reading this study, and a lot of different organizations came together to kind of make this recommendation. We hear a lot about cholesterol. What exactly is the cholesterol, bad cholesterol?
Cholesterol is a waxy, fatty substance that occurs naturally in our body. It helps maintain our cell membranes. Our brain uses it for metabolism and makes its own. We use it to make hormones and vitamin D and other things. It's something that's really important in medicine. It can, having high levels and abnormal levels can raise your risk for heart disease and stroke. So it's something we pay a lot of attention to, and it's really important right now because we have new guidelines from the American College of Cardiology and American Heart Association, amongst some other associations that kind of came together and evaluated what we need to do as doctors to help treat cholesterol, but also what patients can do to help improve it on their own.
And so you're going to get that information when you do your blood work, usually when you go in for that annual exam. Mm-hmm. And from there, they'll obviously talk to you about what's high, what's acceptable.
Yeah, absolutely. So you look at, all different kinds of cholesterol. There are certain types that are more risk, that increase your risk for heart disease more than others. There are some that are actually protective against heart disease, like the HDL you may have heard of before.
Okay, so if we do want to lower that bad cholesterol, what are some things that we can do?
Yeah, so when you look at cholesterol, there's things that you can control, like what you eat, how you move, what you put into your body, smoking, alcohol, things like that. The things that make cholesterol worse are the saturated fats. Foods that are high in saturated fats are animal fats, butters, coconut oil, palm oil, the things that are more solid at room temperature. And then the things we want to replace those with are the unsaturated fats. So your fish oils, nuts, legumes, olive oil, avocados, those healthier fats. And you also want to increase your exercise. So you want to be active, get moving. They recommend 150 minutes of exercise a week. So that can be walking, could be whatever exercise, but that's the part you can do to help move. Then there are other things that we can't really control, some genetic factors that put you at higher risk for heart disease. This is why we take into account screening, so that's why you want to look. And one of the big movements in these new guidelines is to look earlier in life. Even down to 30 years old, we should be looking for cholesterol problems.
And of course that comes with your blood work and those conversations. Is that a big jump from what you had been doing? Do they normally not look at that as a doctor until you reach 40, 50, 60?
In the past, the real emphasis kind of was at 40 years old. That's when we really had the evidence to support treating, and our risk calculators and things were more validated to 40 years old. These new guidelines were down to 30 years old. So. Yeah. At 30 years old, that's really when you should be taking measures to lower your cholesterol if it's elevated. That doesn't mean it has to be medicine, but you really should be changing your lifestyle and focusing on those things to lower your risk of developing heart disease and stroke.
Yeah, we know cholesterol definitely plays a big role in our risk factors.
Yeah, definitely. Especially the bad cholesterol, the LDL, the smaller sticky particles that get on your blood vessels and lead to clots and clogs and things like that lead to heart attack and stroke.
Well, I think like in anything, we talk about prevention. We want to prevent as much as possible. So if we have that message out earlier in life, we have knowledge is power, right?
Yeah. Prevention, and there's treatment if you need it. There are medicines. There are good medicines that have evidence to help prevent the heart attacks and strokes and things like that and lower the cholesterol. Statins you may have heard of. There are other medicines as well that we can add to it or use in place of.
All right, so obviously a good conversation with your primary care provider.
Yeah, next time you see your doctor, ask them about what's changed for me with these new guidelines. Should we be looking differently, earlier? Should I be on medicine? What should I do with my diet? So talk to your doctor about it.
All right, Dr. Kegley, thanks for joining us. A lot of good information. If you would like to learn more or you need a primary care doctor, you can always visit their website. That's holstonmedicalgroup.com.